Know the geography of all your spinal tracts and the sensory information that they provide, and it will make neuro problems much easier. If a patient, and definitely memorize this, has bilateral motor function loss at and below the level of injury, and they can't feel any temperature sensation below that level, either 1 or 2 levels, this is an anterior cord syndrome. Those studying for step 1, why do you have bilateral motor loss? Well, you lost the lateral corticospinal tracts. You lose pain and temperature because you lose the lateral spinothalamic tracts. Now, what's intact? Proprioception, vibratory sensation, and light touch. These are the dorsal columns. These are on the back of the spinal cord. Brace yourself for an extremely silly mnemonic. If what I said earlier made enough sense, you can end the video. But think of the spinal cord as a thermometer. If I break the anterior part of the spinal cord, this represents anterior cord syndrome. Glass will fly everywhere, and I'll probably drop the thermometer. I think of dropping this thermometer as motor loss. I also can't use the thermometer, so I lose bilateral pain and temperature. So this is like losing my temperature sensation. But of course, I can still feel vibrations on my body, etc. So again, that's just like anterior cord syndrome when you can still have bilateral proprioception, vibration sensation, and light touch. Now, if you have a question about someone, let's say elderly, with an underlying cervical issue, and you lose both sensation and motor function of your arms, but relatively your legs are fine, start thinking about some central cord syndrome. It can definitely happen when you have a fall or you have sudden whiplash in a car crash, and it can definitely be associated with bladder dysfunction. Anything that happens up top in the spinal cord will affect what's below it. Another very easy, quick to pick and answer question stem would be a patient with quadriplegia. They can't speak, they can't swallow, but they're conscious. They can blink and look vertically. Definitely think of locked-in syndrome, and this is the ventral brainstem. I think about this with a silly mnemonic like a person is locked in to a van. Locked in for locked-in syndrome, and van as in ventral or vantral brainstem.